Assalamu alaikum. This is Isha Mansoor and my roll number is BP1650058, and the topic that I am going to present today is benzoic acid and salicylic acid. So basically benzoic acid and salicylic acid come under the class of topical antifungals, and they are used as in the form of topical dosage forms, in which benzoic acid is basically anti-infective and is used in bactericidal and fungicidal activity, while salicylic acid is keratolytic, so it helps the body to shed rough or dead skin cells. The rational use of this medication is in skin irritation, inflammation caused by burns, insect bites, fungal infection, and eczema. While some of the unnecessary uses of these medications also take place in the form of daily skincare regimens, which may cause irritation to nose, throat, and lungs, which is its irrational use. And its prolonged and continuous use can even cause eye damage or any other organ damage. The side effects of this medication include signs of allergic reactions such as difficulty in breathing, swelling of your face, lips, tongue, or throat, severe burning, and skin irritation. And now the drug interactions. The drugs which interact with benzoic acid and salicylic acid are adapalene, L-tretinoin, bexarotene, isotretinoin, tazarotene, and tretinoin. The available brands with respect to pharmacoeconomic point of view include Ceproderm, which is by Remington Pharmaceuticals for rupees around 16 rupees, Benzocare by Advocare Pharma, which is for 70 rupees, and Whitfield's ointment by Concept Pharma, which is for 150 rupees. Now, if this medication is unavailable or it has intolerable side effects, we can use other topical antifungals such as clotrimazole in combination with salicylic acid. So it will have the same antifungal and keratolytic effect equivalent to that of benzoic acid and salicylic acid. The preferred dosage form, as I mentioned earlier, are topical dosage forms, which are creams, ointments, and lotions. Now, in case of overdose or toxicity, following effects can be observed, such as skin rashes, nausea, vomiting, diaphoresis, tinnitus, hyperventilation, tachycardia, and metabolic acidosis, since both of the drugs are acids. In case of toxicity, we use certain antidotes. For example, in ketoacidosis, thiamine and potassium supplements are given, or gastric lavage is performed within 1 hour. The GI contamination can also be managed using adsorbents such as kaolin or activated charcoal. In case of acute toxicity, the therapy is focused on securing the airways to overcome oxygen depletion and metabolic derangement. Now, its case study, which includes a 28-year-old female presented to the outpatient department of dermatology at the institute with chief complaints of dry reddish lesions on arms, face, hands, and trunk of the body since past 2 years. The patient has earlier visited dermatologist and was taking itraconazole earlier. After 8 days, she revisited their department and complained that she did not get any relief and the lesions were presented all over her body and no family history was known for the same. For this case, the soap notes will be first the subject, which is age that is 28 years, sex is female, and body weight is around 67 kgs. In object, it is given the patient was presented with dry and reddish lesions on arm, face, and trunk of the body, and the condition was resistant to 8 days itraconazole therapy as seen, and no related family history was observed with the concerning disease. In lab assessments, the patient was advised to get investigated for CBC, glycosylated hemoglobin, urinalysis, fasting blood sugar, thyroid profile, lipid profile, liver, and renal functional test. Until the lab assessment results come, the plan was to keep the patient on benzoic acid and salicylic acid ointment therapy to be applied twice or thrice daily on the lesions to reduce inflammation. So it will help in to control the inflammation and also for its bactericidal and fungicidal activities. I hope this session was helpful to you all. Thank you.